Are you suffering from shoulder problem? If your answer is yes, then get treated rightly by Dr. Sujit Korday. The shoulder, being the most mobile joint in the body, consists of tendons and muscles, which allow moving in practically all directions. However, this mobility function can also make the shoulder joint very unstable and therefore vulnerable to injury. You may experience increasing problems with instability or impingement of the soft tissue or bony structures in your shoulder, resulting in pain. Anatomy of the shoulder. Your shoulder is made up of 3 bones. Your upper arm bone, called as humerus. Your shoulder blade, called as scapula. And your collarbone, called as clavicle. The head of your upper arm bone fits into a rounded socket in your shoulder blade. The socket is called the glenoid. A combination of muscles and tendons keep your arm bone centered in your shoulder socket. These tissues are called the rotator cuff. They cover the head of your upper arm bone and attach it to your shoulder blade. What are the main categories of shoulder problems? Some of the common conditions which causes pain and discomfort with shoulder are: frozen shoulder, shoulder impingement, recurrent shoulder dislocations, labral tears, and shoulder arthritis. What is frozen shoulder? Frozen shoulder is also known as adhesive capsulitis, or periarthritis. It is characterized by intense inflammation in and around the capsule of the shoulder. The affected shoulder joint becomes very painful and stiff. How is frozen shoulder treated? In most cases, frozen shoulder will resolve by itself over a period of 1 to 2 years. There are 2 basic forms of treatment. Non-surgical treatment. Surgical treatment. Non-surgical treatment consists of anti-inflammatory drugs to reduce the treated pain and inflammation. Physiotherapy, which includes heat treatment and exercises to maintain movement in the shoulder. Steroid injections in the shoulder to reduce inflammation. Surgical treatment. Occasionally, some patients who fail to respond to therapy and anti-inflammatory medicines may then require surgery. The goal of surgery for frozen shoulder is to stretch and release the stiffened joint capsule. This is usually done by arthroscopy, to remove the inflamed tissue, and to release the tight capsule of the shoulder joint. What is the recovery time after surgery for treating frozen shoulder? The recovery times vary from 6 weeks to 3 months. After surgery, physical therapy is necessary to maintain the motion that was achieved with surgery. Although it is a slow process, your commitment to therapy is the most important factor in returning to all the activities with your shoulder. Long-term outcomes after surgery are generally good, with most patients having reduced or no pain and improved range of motion. Although uncommon, frozen shoulder can recur, or one may get it in the opposite shoulder, especially if a contributing factor like diabetes is present. What is shoulder impingement syndrome? Shoulder impingement is also known as painful arc syndrome, and it is a condition that develops when the rotator cuff tendons in the shoulder are overused or injured, causing pain and impaired movements. What are the symptoms of shoulder impingement syndrome? Patient with impingement typically gets pain on lifting the arm up and forward in the mid-range of arc, and hence it is called painful arc syndrome. How is impingement syndrome of the shoulder treated? There are 2 basic forms of treatment. Non-surgical treatment. Surgical treatment. Non-surgical treatment consists of anti-inflammatory medication, injection of steroid to reduce pain, physiotherapy to improve the movement and strength in the shoulder. Surgical treatment. Those patients with tendinitis, or rotator cuff tear, who do not respond to non-surgical treatments, require arthroscopic surgery to remove the bony spur on the undersurface of the acromion, or to repair the torn tendon. Those patients who have calcific tendinitis require removal of the calcium deposits by keyhole surgery. What do you mean by recurrent dislocation of shoulder? Recurrent shoulder dislocation is a condition characterized by repeated partial, or total separation of the ball of the shoulder joint from the socket. When does recurrent dislocation of shoulder occur? Recurrent dislocation of the shoulder usually occurs in young adults engaged in highly demanding sports, or job activities. However, in some patients, it may also occur during normal day-to-day activity, even during sleep, causing the patient to wake up. In some patients this can occur during an epileptic fit or after sustaining an electric shock. Who should get the surgery? Anyone who has repeated shoulder dislocation which affects their routine work, or sporting activities, should discuss the treatment options with their physician. Most of these patients will require surgery to repair the damage to the labrum, and to tighten the lax capsule. This is usually done by arthroscopic surgery. After the surgery, patients can be expected to make full recovery of shoulder function and return to their normal routine as well as sporting activities. Dr. Korday has a vast experience in treating patients with repeated dislocations of the shoulder, rotator cuff tears in the shoulder, ligament injuries of the knee, which he treats with arthroscopic surgery. Dr. Korday also has a huge experience in performing knee, hip, and shoulder replacement surgeries, using various implants and new techniques. Dr. Korday is also a teacher at some teaching hospitals in Mumbai. Dr. Korday is associated with leading hospitals and medical institutes in Mumbai. For more specific advice about your shoulder problems, you can contact Dr. Sujit Korday. To schedule appointments for consultations and surgical procedures, please call 9930-035-032. Email your queries to skorday@gmail.com or visit www.kneeandshoulderpain.in and www.jointsurgery.in.